The human body rarely sounds a loud alarm when something goes wrong. Instead, it sends subtle signals, small physical disruptions that are incredibly easy to brush off. After the age of 50, things like occasional fatigue, unexpected bloating, or minor shifts in digestion seem entirely normal. At age 67, David noticed some of these exact changes. Some days he felt uncomfortably bloated. Other days he dealt with unexpected bouts of constipation. He didn't panic. Like many people, he assumed these minor discomforts were simply the standard background noise of getting older. Months passed. The digestive symptoms happened a bit more often, but the most noticeable change was an unusual, persistent fatigue that he couldn't shake. People often delay seeking medical advice, not because they lack symptoms, but because we mislabel these quiet, critical signals as the harmless aches and pains of aging. This kind of mislabeling happens every day with colon cancer, one of the most common and pervasive health threats affecting adults over 50. Major global health authorities track this disease closely. Organizations like the World Health Organization continually monitor its prevalence worldwide. National research groups, such as the National Institutes of Health, also dedicate massive resources to tracking how widely this disease impacts the aging population. The medical community has understood the urgency of this threat for decades, prioritizing early diagnosis to save lives. The reason colon cancer is so challenging to catch is its slow, camouflaged onset. It perfectly mimics the mild, non-threatening digestive issues that everyone experiences from time to time. Catching it requires a shift in how older adults treat their baseline health, moving from passively accepting discomfort to actively observing physical changes. Doctors rely on a clear framework to help patients separate harmless age-related noise from signals that demand immediate attention. The first thing to watch for is a break in your normal patterns. Persistent diarrhea or ongoing constipation lasting several days is a signal worth checking. Another clear indicator to watch for is highly visual. Blood in the stool might appear bright red, or it could make stools look unusually dark. Pay attention to localized, ongoing physical sensations as well. This includes persistent abdominal cramping, pain, or the feeling that a bowel movement is incomplete. This diagram shows how sometimes the signs are systemic. Slow internal bleeding in the digestive tract leads to anemia, which causes that ongoing, unexplainable fatigue and weakness. That ongoing fatigue is exactly what prompted David's friends to intervene. He reluctantly scheduled an appointment to figure out what was going on. Further testing revealed a hidden condition that required prompt treatment. Listening to uncomfortable or persistent physical signals, rather than trying to tough them out, is the necessary first step to disarming a hidden threat. The timeline of this disease begins long before those physical symptoms occur. It starts with a completely silent phase at the cellular level. This schematic shows the interior lining of a colon. These silent growths, called polyps, are where cancer originates. Routine screening acts as a sensitive receiver. It detects and removes these polyps before the body ever sounds an alarm. Preventative screening programs like this have dramatically reduced colon cancer deaths across multiple countries. Waiting for visible symptoms to appear puts you at a disadvantage. Proactive screening neutralizes the threat while it is still just quiet background noise. Beyond medical procedures, daily habits offer a powerful layer of defense for your digestive system. A strong dietary defense involves increasing your fiber intake. This means eating more fresh vegetables, fruits, beans, and whole grains. Physical defense is equally important. Maintaining a healthy body weight and staying physically active both support long-term digestive well-being. There are also behavioral risks that need to be eliminated. Smoking, in particular, drastically increases the risk of multiple cancers, including colorectal. Because David's cancer was caught early enough for effective treatment, he remains highly active today and continues to enjoy time with his family. He often shares a straightforward message: don't ignore changes in your body. The goal is mindful observation, not constant anxiety. Healthy aging is a practiced awareness that buys us more time. Speaking of time, join us in our next video as we look at the daily routines of the longest living people on Earth.
Remember, life after 50 isn't about slowing down. It's about living stronger, healthier, and happier. If you enjoyed this video, please like and subscribe, and share it with someone you care about. This is Longevity After 50, adding life to years, one step at a time.